This is the Whole Care Network. Helping you tell your story one podcast at a time. Content presented in the following podcast is for information purposes only. Views and opinions expressed in this podcast are solely those of the host and guest and may not represent the views and opinions of the Whole Care Network. Always consult with your physician for any medical advice, and always consult with your attorney for any legal advice. And thank you for listening to the Whole Care Network.
I think a lot of people are afraid of dying because they fear that dying is going to be painful and a struggle. And in many cases it is. I understand why they would have that fear. But I've seen it on time and time again where it can be done really beautifully with the right approach and the right attention and the right care and team.
This is the Heart of Hospice podcast with Helen Bauer. Today's guest is hospice and palliative physician Dr. Bob Uslander, founder of Empowered Endings. Whether you're a family caregiver or an end-of-life professional, the Heart of Hospice podcast is here to enhance your hospice experience by connecting you with information you can use about end-of-life care.
This episode is sponsored by GrandPad. GrandPad is the all-in-one tablet designed especially for senior adults. With GrandPad, you get safe, simple video calling and photo sharing. Users can create a private family network that allows for secure photo and video sharing. The GrandPad utilizes a simple format that allows seniors to enjoy games, music, email, and more. Visit our special GrandPad website designed exclusively for the Heart of Hospice listeners at grandpad.net/THOH.
My guest today is Dr. Bob Uslander. He's the co-founder and medical director of Empowered Endings, and he's a pioneer physician that's leading the movement to shift the paradigm of end-of-life care by supporting, guiding, and teaching an empowered approach to palliative and end-of-life care. After several years' experience as a physician in emergency medicine, Bob began practicing in palliative care and hospice care, and now he's the leader of Empowered Endings Medical Group. They're working to provide compassionate, informed care to patients and their families. You can learn more about Empowered Endings and Dr. Bob Uslander at their website, empoweredendings.com. So you're going to hear an in-depth conversation today. Really an interesting blend of both personal and professional experience with Bob. He shares his story of how he began working in hospice after having so many years as a physician inside the ER. His first understanding of hospice came through a personal hospice experience with a friend of his, and then with the deaths of his parents. And you're going to hear him describe these stories for his parents' death and their experience with hospice and how their experiences were so different from each other. Bob's going to give some examples of how end-of-life doulas can be integrated into the support of patients at end of life and how Empowered Endings utilizes doulas. Bob's practice also supports people who choose medical aid in dying. He's been offering this support since MAID became legal in California in 2016, and he's going to give some detailed information about that. Empowered Endings also offers specialty bereavement support for families whose loved ones have chosen to utilize MAID. And Bob is going to explain the myths and misconceptions that are associated with medical aid in dying, and he's going to share a specific story of someone who utilized MAID. So sit back and get ready for a great conversation. Here's my interview with Dr. Bob Uslander. Bob, it's so great to have you on the show. Welcome to the Heart of Hospice.
Thanks, Helen. I appreciate it.
Well, I'm going to start out with an icebreaker question that I did not tell you about. I like to do this. My listeners know I have a tendency to do this. So I am a big fan of the End of Life deck. and the death deck?
Yep.
Yes.
As am I.
Yes. Awesome. So I pulled a card from the End of Life deck. And so here's your question. If you could plan your own celebration of life party, where would it take place? And what would be the theme?
Ooh, that's a good question. It's so interesting because I have a lot of people who I'm sort of connected with who plan these parties and who have end of life celebrations. I'm not sure I've ever thought about where I would want to do it, and I think probably it would be on the beach, because I love the water, I love the beach, and it's such a sort of an open, free kind of environment for me. My wife Elizabeth and I, we celebrated a century of life and love party a couple of years ago, and we had a huge beach sort of extravaganza because I turned 60 and she turned 40 on this in the same year, so we had that big party. And I think I would probably kind of recreate that theme, a celebration of life and love, because that's kind of the legacy that I want to leave behind, is just the idea of living fully, loving fully. So it would be on the beach, kind of an all day, come and hang as long as you want and enjoy, and let's just make it about love.
I like that. That's awesome. That is a good part of your advanced care planning. I figured if I asked you a question about advanced care planning, considering the work that you do, you should have a plan in place, right? Those are conversations that you should be having. So I figured I'd come up with something good if I asked you that.
Yeah, no, I appreciate that. And actually, I just had this recognition that term, that phrase, live fully, love fully, that actually came from my 17-year-old son during a conversation that we had a few days ago. So I realized that we're doing something right with him, because that's his sort of mantra, and I'm now borrowing phrases from my 17-year-old that are really meaningful and impactful. So that's cool.
Wisdom from a teenager. He's learning something good from you guys.
Yeah, for sure.
Yeah.
For sure.
So let's start talking about how you got into this work. You had a career path working as an ER doc. You had spent several years in emergent medicine. What compelled you? What pushed you into working with people who are facing end-of-life issues?
So that's a bit of a complex and convoluted story. There were a number of different points and experiences that led me to that path. As an ER doc, you're aware that you're really spending most of your time trying to save lives, right? You're identifying the things that are causing people to struggle, and you're trying to solve problems and understand, what the solutions to their problems may be. But when people come in and they're either dying, or in some cases they've already died, but everyone's still trying to bring them back to life. That's just sort of the MO. You don't at the beginning of my career, especially, which my career started in the early 90s, there just wasn't a lot of focus on trying to determine whether somebody would want to be resuscitated, or if the quality of their life was going to be satisfactory or reasonable if you did resuscitate or save them. So we just did what we were trained to do without thinking much about it. And I'm sure that over the years we there was a lot of trauma that we perpetuated, and I know it was traumatic for me and for the people working with me to do some of the resuscitations that we did, and about 10 years into my career, I had a good friend die of melanoma. His name was Darren Farwell. And our kids went to school together. His were a little bit younger than mine, and he was a bit younger than me. He was only 32 when he died. And he had a mole on his back that was removed about 5 years earlier. It was diagnosed as melanoma, but the doctors told him that they caught it, they got all the margins, and he can go on and live a long, healthy life. And about 4.5 years later, he had a lump under his armpit, and it kept growing, and he went and had it checked out, but they biopsied it, and it was melanoma. And after a few attempts at treatment and experimental therapies, it was clear that the melanoma was spreading and it was going to end his life. Darren had a wife who was 29 and 3 boys that were at that time 5, 3, and 1. And he started getting sicker, and the cancer was spreading. And I, as his friend and as really the only doctor that he had a relationship with at the time, I helped to just navigate certain things for them and help them understand kind of what was coming, and assured them that I would be there with them to help comfort and support. And as he got more ill, we brought in the local hospice company. I was at that point living in a small town up in Northern California. And there was one hospice company in town, and I had no idea what hospice did other than take care of people who were dying. I didn't know how they went about it and had really minimal exposure to hospice. And the experience of working collaboratively with that team of the medical director for the hospice was a friend of mine, who I'd gone rafting with on the Colorado River and had some really wonderful experiences. And he kind of took me under his wing and mentored me a bit in how to be most supportive for Darren and his family. And we created this beautiful experience for them. And we just did a number of activities and had some rituals and really supported them in a way that was just magical. He died on September 14th, 2001. So it was 3 days after 9/11. And it was just a very intense and sad time, but also the people that came together, knowing how we supported each other and made his final weeks and days really meaningful and really comfortable and free of pain and struggle. It was magical. And for the first time, I was able to experience a death that wasn't traumatic. It was tragic, but it wasn't traumatic. And many of the people who were part of that little intimate group had experienced something transformative. So there was a seed planted for me in that experience. I didn't really change my course for a while. I just kind of sat with it, and it just sort of kept kind of germinating, I guess. About a year later, I started a house call practice for homebound seniors, and I was doing a bit of hospice care for some of those patients. Because there were many people requesting support, additional support, I started a home care company, and we did non-medical home care and care management, and I just kind of continued doing. I started a nonprofit that took over running a adult day healthcare center, just looking for ways to be to fill gaps and to find solutions to some of the challenges that people were having, especially the older adults and people who were approaching end of life. And then I ended up moving to San Diego about 10 years later, after all that happened with Darren. And a relatively short time after I moved to San Diego, I actually was sitting on a bluff contemplating the next stage of my career, because I was really getting pretty burned out with emergency medicine. And it was very intense, very stressful. They were working nights and weekends, and I just felt like there was something more, something else that I needed to be doing. And that came to me sort of as a epiphany or like a download, very unexpectedly. One evening when I was just sitting on the bluff looking out at the ocean in San Diego, And I had this like clear, I heard and kind of felt the words, "You're here to help people die better," as if it was like spoken right to me. And I just kind of was startled and but at the same time really energized. And I ended up the next day, I ended up meeting just spontaneously at a festival. I met a nurse that was a hospice and palliative care nurse working for a company that was starting a palliative care program. And honestly, at the time, I didn't even know what palliative care was.
Right.
This was like 2013.
Yeah. It wasn't a thing.
It was like the beginning of a thing, but she had to tell me like what does a palliative care doctor do? And she started talking about it, and I thought, wow, that sounds amazing. I'd like to do that. And then I ended up, she introduced me to the owner of the company. It was a hospice company that was building a palliative care program. After a couple of meetings, a few months later, I was the new medical director for this palliative care company. And I am going into people's homes and addressing their challenges and meeting their families and learning about all the things that went into providing really good, comprehensive support for people with complex illness. And I got to work and do a little bit of work with hospice as well. And after a couple of years of doing that, while it was really fulfilling in some levels, I became so aware of all of the gaps in that part of the healthcare system. As an ER doctor, I was aware of so many other gaps because everything sort of trickles down and it ends up in the emergency room. So you see all the challenges and problems out there. But I had firsthand exposure to all of the gaps in hospice and palliative care that caused people to struggle. And they were gaps that it wasn't rocket science to try to fill those gaps. It just meant showing up a little bit, more intentionally and compassionately, but the system can't do it. So after a couple of years, during which time both of my parents developed terminal lung cancer and died, each of them had a very different experience of end of life, which also informed me quite a bit about, the challenges that family members face and the ways of helping to guide and support from the other perspective, from the other side. And then I started my own practice. I got to the point where I didn't feel like I could fully deliver the kind of care and create the kind of work environment that I wanted. So I started my own practice, and that was 8 years ago. So that's the story. That's how I got there. Darren was an inspiration. The experience was incredibly informative. And then just along the way, I just had the right things showed up and the universe guided me.
Yeah. The encounter with the nurse. And it sounds like your parents' experience was formative as well. So I have to ask you, were you a hands-on caregiver for your parents?
Yeah, for sure. Yeah. With my mom, I was working pretty hard, and my dad was there. He was very capable, and he was very engaged. And she had a course that kind of deteriorated over about a year, and a number of different things that were challenging and frustrating and hard to pinpoint. And my dad was kind of taking her all over trying to get answers. And then the last few weeks, things really became intense. And I put a lot of things on hold to provide support for her during that final stage. And there were things that weren't set up adequately, that weren't anticipated, that caused her and all of us to struggle quite a bit. And so it was pretty traumatic ultimately, but I learned a lot, and that informed a lot about how I approach some end of life scenarios and the way to be proactive and thoughtful about what needs to happen. And then with my dad, it was very different. So she died, and then my dad took a while to kind of get back into the flow of things. But he was like working full time. He was running our home care company actually at that time. He was an engineer who reinvented himself a number of different times over the course of his career. And at 75, retired and started running my little home care company, which was really cool. And he was hanging out and spending a lot of time with my son. And then just out of the blue, he was diagnosed with stage 4 lung cancer 8 months after my mom died. And he died 4 months later, and had a very gentle, very beautiful, kind of what I refer to as a gold standard of end of life. And so kind of what I wanted to do is prevent the trauma and the kind of PTSD and damage that occurred from my mom's end of life experience, and help people have more of the experience that my dad had and that Darren had. And, 8 years later, we've been able to have incredibly great results, outcomes with people who are going through these end of life journeys by filling the gaps that most people unfortunately don't get filled through the system.
Your story, your personal story with your parents and your experience with Darren are so important, because I think there is an expectation of healthcare workers, even those of us who work in palliative and end-of-life care in hospice, that our personal experiences with hospice are perfect, that we know what to expect, we handle it well, we've got everything under control. And of course, that's not true. Yeah. That's not true. Would you say that there were mistakes and missteps that you made even in your personal experience with your parents?
For sure. Yeah, for sure. But at the time, you don't know what you don't know.
Right.
And you can't anticipate everything. To drill it down a little bit. My mom came, she ended up in the hospital. We actually were going to my older son's graduation in Santa Barbara's college graduation, and the family was all going, and it was going to be a challenging trip for her because she was dealing with the impact of this recurrence of lung cancer, and had started some treatment. And so she was weakened and struggling a bit, but we got there, and really as soon as we got to the Airbnb that we were staying at, she started having trouble breathing and ended up needing to go to the hospital by ambulance. She went into the hospital, stayed up there, and then we ended up transferring her down to a hospital in San Diego. Became very clear that she was terminal and she was not going to be able to withstand more treatment. And so we put her on hospice, a hospice that I was working for and working in the palliative care in the hospice department. Brought her home and anticipated she'd have, a few weeks to maybe a couple months of life left. And that same night, she ended up having a choking episode, and she was unable to breathe. And I was alone with her. My dad had gone out to get some juice or something, thinking everything was going to be fine. And in the meantime, she's choking, gasping for air and struggling and I didn't have anything to give her. I didn't have any adequate medications. There wasn't a comfort kit. We didn't have morphine. We didn't have Ativan. So there was nothing I could do. I found some like hydrocodone or some pain pills. I had to crush them up and dissolve them in water, and I was dripping it in her mouth, putting it into wherever I could as she's in this sort of the throes of choking, because she had very little lung capacity. When she started choking, it just kind of threw her into this state. So we ended up, getting morphine, and she never woke up from that. She never woke up, and until she finally died. The evening after that, after all that happened, she was writhing around. Even with all the morphine in her system, she was writhing around and becoming increasingly uncomfortable and couldn't figure out why. And after a bit, I was able to tell that her bladder was distended, and so she had like an obstruction of some sort because she wasn't able to urinate or empty her bladder. And I called the hospice folks to have a nurse come and put a catheter in her. It took 3 hours. And in the meantime, the 3 hours felt like eternity. And basically all we could do was load her up with more morphine, and that was incredibly traumatic for everybody. So a couple of lessons learned. When patients get home when they get on hospice, we immediately get them the medications that they need in case an emergency type situation happens. When my patients get admitted to hospice, I have a catheter delivered and a catheter insertion kit delivered, so it's at the house. And I'm much more proactive. I'm much more knowledgeable about some of the things that can go wrong to create challenges that don't need to happen.
Yeah. What a hard way to learn those lessons. What a hard way to learn those lessons.
Yeah, for sure. And, I'm as an ER doctor, I've been exposed to so many horrific things over the years. So I wouldn't say I'm hardened to it, but I'm able to, I was able to sort of manage through it. I think it was much more harder for my family wasn't there at the beginning for the first episode. So fortunately, they didn't have to experience that. But, the other, I realized that people who haven't been exposed to that are often really traumatized. So much of what we do, so the experience of that struggle, and then how gentle and beautiful my dad's and final days and death were, gave me such a perspective as the loved one that I now am able to relate to people who are going through this on a very different level. And one of the things that I became very aware of, and Elizabeth and I our practice is really focused on taking care of the families, because the patients usually get their needs met, not always ideally and not always promptly, and it's not perfect, but ultimately they get medicated, they get comforted, they get, they ultimately get what they need, and then they die. That's part of the journey they're on. The families are often left out in the dark, in the cold. They often don't get their needs met. Their needs are not addressed adequately from the beginning of the health challenge of that journey, from the beginning of the diagnosis of a terminal condition to when they get moved through the system. The families are responsible for so much of the support and finding the care and bringing in the resources, and they don't get support, and they struggle, and they end up living for years or decades with the regret and the guilt of not being able to do a better job, not knowing how to find the right resources. So we realize that a lot of our work goes, and that's a lot of the reason we bring in doulas. We work with doulas often. We're trying to really bring end of life doulas into the forefront and recognize that partnering with doulas and doctors can provide a level of support for the families that has been largely ignored up until now.
I am loving this conversation, but we're going to take a break right now. There's more to come.
If you're looking for an easy solution to stay connected to your older loved ones, GrandPad is everything you need. It's the all-in-one tablet designed especially for seniors. With GrandPad, you get safe, simple video calling and photo sharing to connect the whole family. The GrandPad utilizes a simple format that allows seniors to enjoy games, music, email, and more. GrandPad comes with 4G LTE cellular service already included, so there's no need for Wi-Fi. Users can create a private family network that allows for secure photo and video sharing. At the core of the GrandPad team are the Grand Advisors, a group of seniors that continually inspire, test, and guide the development of GrandPad. The company has built a platform that empowers seniors of all ages and technological skills to safely connect with family, friends, and caregivers. No spam, no robocalls, only connections with those you trust. The GrandPad team strives to create a world where no senior is lonely or isolated. It's the smart choice to keep older adults connected. Visit our website today at grandpad.net/THOH or call 1-888-904-4723. GrandPad, keeping seniors connected. This episode is brought to you by our friend Jody Clock. Are you feeling stressed about planning for the future? Don't wait until it's too late. It's Complicated by author Jody Clock is your easy guide to understanding elder care. This book helps you learn about important topics like Medicaid, funeral planning, and how to protect your money. With It's Complicated, you can create a simple family care plan that helps you take care of your loved ones. Say goodbye to confusion and misinformation and take charge of your future. This book makes complicated subjects easy to understand, giving you peace of mind as you read. Don't put off important planning any longer. It's Complicated can help you make smart choices for yourself and your family. You can find it now on Amazon or at jodyclock.com. Let Jody Clock's helpful advice guide you through these important decisions, one chapter at a time.
When you partner with doulas as a hospice physician to support a family and a patient with a life-limiting illness, how do you coordinate and include those doulas in the care that you're providing?
Well, there's a whole series of ways. We have a handful of doulas in San Diego and Los Angeles and Palms, all the areas in Southern California that we provide care and support. We've identified doulas who want to work with us in providing support. So a number of the doulas are nurses who have worked either in the hospital or in hospice, and they have gotten to a point where they want to continue delivering optimal end-of-life care, but they don't feel that they can do it in the system. The hospice agencies they work at run them ragged. They don't give them enough time to really support patients and families. So a lot of them are social workers and spiritual counselors. A lot of the people who have been in hospice are looking for alternate ways to support people. Some of them are coming from more of the grief counseling, grief coaching space. They come from a lot of different walks of life.
Yes.
So we have nurse doulas, and we have social worker doulas, and we have grief coach doulas. And when we engage with a patient and family, we typically, depending on what their circumstances are, what their needs are, what their resources are, we will introduce them to a doula who becomes a part of the team. And me and other physicians who are part of the practice provide the medical care and oversight and kind of the leadership of the clinical team. And the doulas are complementary to that. They will go in and visit with the patients. They'll the families, they'll give their phone numbers, as do I. Everyone knows how to get a hold of us when they need to, which is also a very different thing than what happens in the traditional system. Right. Doulas are often, kind of go through the whole end of life checklist with patients and families. They may use the death deck to explore, help identify, create legacy projects, identify the kinds of rituals that the patients and families might want at the time of death. We support a number of patients through medical aid in dying, and the doulas engage with the patients and families upstream as they're navigating through the process. They'll usually be with the patient and family at the time that they ingest the medication, and then provide ongoing bereavement support after the person's died. So, we use doulas in a number of different ways. Fortunately, we have some doulas that are nurses, so they actually are able to provide clinical nursing support as well. And then others who are more non-clinical but come from a grief and bereavement background, and some really focus on that. So we try to match the patients and families to the appropriate doula. And sometimes we have more than one doula engaged with a patient and family. We're also trying to encourage the hospices in our area to utilize doulas. And we recognize, if hospices were able, hospices use volunteers, but volunteers are not really able to do much other than provide companionship.
Right.
If hospices understand how valuable doulas can be to the equation and to the system, the patients and families would likely be far happier with the service they're getting, because they're now having an additional layer of support that isn't coming necessarily once every week or once every month, and and has to do all the charting and documentation, and
right.
it would provide a layer of support that is missing, one of the huge gaps that's currently challenging people in this journey.
Doulas have a unique, I guess I would say, advantage, because they are not tied to all the documentation and the regulatory and the licensing stuff that we are. So they bring in that additional layer, but a special relationship, because unlike a volunteer who has no training in grief and bereavement support or, end of life education and support, these doulas do. So they have a special role to play, I think.
Yeah, I 100% agree. And I also recognize that you have to be selective. People, so anybody can go out and do a doula training and get a certification,
right?
But they don't necessarily have the experience or the capacity to be of support. They, if you have the person without the right training and experience, they could actually cause more damage. So there's great value, but you have to be very selective. And we're training doulas and developing our own. We're not going to do like basic doula certification, but we're going to take doulas who've gone through a doula training course, and then help mentor them and give them education and training in optimal end of life care, empowered endings certification for doulas who really want to learn how to do it well.
Well, that's the flip side of not being licensed and regulated, right? There's no standardized education. So if you want to add in a doula, you have to make sure, because anybody can hang a shingle out and say, "Hey, I'm a doula. This is what I know how to do." So, yeah, having the additional training like that is pretty amazing. And having a nurse doula, a social worker doula, they bring these special skills, I think, that really create some robust care for a patient. But I want to touch back on something you said. So supporting patients at end of life who are choosing medical aid in dying. And I want to touch back on this because I think it's an important topic. So here on the podcast, because of where I'm based in Texas, medical aid in dying is not a legal thing for us. It's not legal here in the state of Texas. So my exposure to it is vicarious through other people. And I love being able to share that education. Our stance on the podcast is we inform you, you make a choice, and we respect the choice. But I love talking with clinicians who are actually working to empower and support patients who employ medical aid in dying. It is a special niche inside hospice and end-of-life care. I think it's very misunderstood at times. There's a lot of, not mystery, but not a lot of people know about it. So when it comes to being a physician who is supporting someone, a patient who is going to use medical aid in dying, how is the physician involved? What's your role with these patients and their families?
Well, the role of the physician there's a pretty broad spectrum of how physicians may engage with or approach this specific area of end of life care. my own my personal journey with medical aid in dying is I started my practice in January of 2016 when medical aid in dying wasn't legal in California. At that point, it was legal in Oregon and Washington State. The End of Life Option Act had actually gone through in October of 2015, but it wasn't. There was a waiting period, and it was slated to go into effect in June of 2016. And when I started my practice in January of that year, I actually anticipated that doctors would be availing themselves to this option and supporting their patients when they were asked to. And I was really, I guess looking back, I shouldn't have been surprised, but I was taken by surprise when people started calling me in the days leading up to the date when it would become legal, asking for me to support them, because they'd been trying to get their own doctors to agree. And I had people who would call, their primary care doctor, their neurologist, people with ALS, their oncologist, and nobody would even talk about it. No one had any knowledge about it. The hospital systems at that time had not developed programs. So there was a law that was going into effect that was going to allow people to have this option, this legal option to end their suffering on their own terms, but no one would help them. So essentially it wasn't available. So I started looking into it. I started calling some of the doctors in Oregon and Washington to get their their perspective, and I decided that it was a reasonable thing to take on, to start supporting people, because I had my own experiences of my own parents going through their journeys. I know my father would have absolutely wanted that option available. Probably wouldn't have ever utilized it because the need never arose for it. He never struggled quite that much, and my mom wouldn't have been able to do it either. But I knew people, and I had been exposed to many people who would have. And now people were calling me and asking for my help. So I learned about the process. I started supporting people. And quickly, I realized what an amazing gift it is to be able to offer somebody. I wasn't promoting it. I wasn't, trying I wasn't encouraging people to consider it. People who were looking to me for support, I educated them about it, and I educated myself about it, and I educated my team. And what I realized was the gift of empowering people to make these decisions, to allow them to choose whether or not they were going to endure the final stages of a terminal condition was amazingly empowering. It brought great peace of mind, not just to the patient, but to the families as well. Even people who were initially resistant and didn't feel comfortable with their loved ones making this choice, when they realized what an impact, the impact that it had on their loved one who was struggling, and they saw them suffering and now saw them able to just basically take a drink, go to sleep, and end that suffering, the transformation that happened in people was so dramatic. So that it just became part of my practice. It was one of the things that I became, and I started realizing what people need to have this go very well, because so often I saw people who started the process with another doctor, and ultimately that other doctor didn't know how to, wasn't willing to complete it. They found out that the group or the hospital that they worked for wouldn't allow them to do it, or they just dropped the ball. So many stories of people who thought they were going forward with the process, only to find out well into it that it wasn't happening, and they needed to start over and find somebody who could really do it properly. Started understanding the impact that it had on the families and the importance of counseling families, providing them with support leading up to the time of the ingestion, and being present with them at the time that the person took the medication, and providing support for them after their loved one had died. So we've become extremely proficient, I would say, at facilitating and supporting and allowing this to happen in the most beautiful and dignified way possible. We have a nonprofit as well, the Empowered Endings Foundation, and one of the programs that we offer in that foundation is a free bereavement support group for families who help loved ones go through the process. So they can come anytime, every Monday evening at 6 p.m. They can join a Zoom with a group of people facilitated by one of our grief counselors and join a community of people who have gone through this experience and want to talk about it. And it's open to people who, from anywhere in the country. And we find many people coming to that group who didn't have the proper support as their loved one was leading up to this or at the time they took the medication. And they experience quite a bit of trauma and like PTSD at times around the experience because it wasn't done well. And so we continue to learn and we continue to enhance the care and the support that we provide to people through this process.
Bob, would you say there's still a stigma attached to medical aid in dying for those who have survived and supported a loved one? How, is that impacting their grief and how they share it?
I imagine, for sure, I think there is a stigma in some, but the experience is so variable. We have people who go through the journey and they just want to tell everybody how amazing it was, and they want to be advocates, and they feel so fortunate that they learned about the process and were able to offer their loved one the gift of supporting them. And then there's others who want to be very quiet about it. They feel like they don't want to tell anybody, or sometimes their loved one said, "I don't want you to tell anybody. I want this just to be a very intimate thing, just between in our family." Sometimes people don't want certain members of the family to know, and certain members of the family to know, which also creates challenges because those are sometimes difficult secrets to keep. So there's a bit of a stigma in some cases. I know that there's still people in 75% of the population in California still doesn't know this law exists, which is mind-boggling to me.
Wow. I
still come across people in healthcare, people in hospice or working in the hospitals who don't know that the law exists, or they have a lot of misconceptions about it. I get very frustrated when I hear hospice staff telling people false information, that it's the process is going to take months, and if you can't swallow, you can't do it. And there's so many things that people are misinformed or uninformed. And I had a patient who had esophageal cancer. He was an amazing man in his early 60s, great family, loving family, but he was struggling. He'd done everything he could to battle the cancer, and now he was at a point where he was skin and bones, on pain medication, just basically in diapers. I mean, he had lost so much of his dignity and he wanted out, and he would tell people, I don't want to keep doing this. I can't keep going. This is horrific. And nobody told him that there was an option. The oncologist didn't tell him. His primary doctor didn't tell him. The hospice people didn't tell him. A friend of theirs came to visit, and the wife was talking to this friend and said, Jaime is like, he's struggling, he's suffering, and he just wants to go. And the friend said, "Well, there's an option. Do you not know about it?" And when they were informed about it, they were angry. They were just angry that nobody had shared this information when he was basically begging for someone to help him. And we ended up like a week, or I think it was maybe almost 10 to 14 days after we initially met, he had, he planned his departure. He had a beautiful, gentle exit. And his wife has been a very strong advocate. She went on, was interviewed by the news in San Diego, and she's done podcasts, and she doesn't want anyone else to have to experience what he had to experience if that's not their choice.
Yeah.
She just wants to make sure people have choice. And again, not promoting it, not pushing it, just giving people the information so that they can make educated, informed decisions about what's most aligned for them.
It's not an easy decision, but do you think that healthcare providers that are informed about medical aid in dying, that are knowledgeable about what it is and how it works, do you think that our personal beliefs, personal biases affect whether we pass on that education to our patients and their families?
100%. 100%. That happens all the time. I speak with doctors who clearly, because of religious reasons, moral reasons, they believe that it's a violation of the Hippocratic Oath, which I think is kind of ridiculous. We started on the Hippocratic Oath, and they will absolutely not discuss it, and it's unethical in my view. And I believe that the law has made it clear that if somebody makes a request, is inquiring about this, that even if you don't participate, you are required to document the request has been made and provide a referral or give them resources so that they can, find that information. But I'm sure that's not happening because people believe that it's, either immoral or should be illegal. And there are doctors who are trying to oppose it so strongly that they're trying to reverse the law.
Right.
There's multiple suits that have been filed, and I think that that happens in the palliative care world and the hospice world, where people don't agree and may not provide the information. More and more, I'm finding because people who work in hospice and in palliative care, they tend to be people with big hearts and compassion, and it's very affirming for me when I do meet people who don't agree with it philosophically for religious reasons, whatever, but they don't necessarily support medical aid in dying, but they still make sure that the patients get the information or have access to what's legally available to them. We do a lot of education in hospice agencies and other organizations, healthcare organizations, around medical aid in dying. And we also educate a lot about voluntarily stopping eating and drinking, which is another really important legal end of life option that is very misunderstood and underutilized in my experience and opinion.
It's hard not to allow our personal biases, beliefs, opinions to enter into these decisions. But the process that you're describing about documenting that first request from a patient, in several states that's important because that is the beginning of the process. And it's legal documentation that's required. And it sets off, in many states, the timeline that's required. Sometimes some places have a waiting period. And for these patients that are considering and have the clinical symptomology and disease trajectory where medical aid in dying is an option, that timing is really important, because to be able to self-administer, there's sort of a sweet spot. And when they lose that ability, they've missed that window, then medical aid in dying gets taken off the table for them. So I want my listeners to know how important that timeline is.
Yeah, it's very important. And in California, I'm not expert at the laws, the specifics of the laws in all of the various states, but in California, the waiting period used to be 15 days. And there were many people who couldn't make it through the 15-day waiting period. They would initiate the process and then would decline in that interim. And by the 15-day mark, they weren't able to communicate. But some of them had died, but many of them had declined to the point where they were no longer competent. A lot of times because their symptoms progressed and they ended up getting more heavily medicated, and once people are getting more morphine and Ativan, then they're mostly asleep and not really cognizant. The waiting period was reduced in California from 15 days to 48 hours through an amendment to the law 2 years ago, a little over 2 years ago, and many more people have been able to successfully go forward with the process than were able to previously. Not everyone gets through the process in that short time frame, and many people choose not to either end up not taking the medication for a couple different reasons. But being able to get through it in a shorter time frame, not having to. There are many people who are literally dying, and they are so miserable and they're in so much distress that they can't imagine waiting another week or 2 weeks for the dying process to occur. So they would often need to be medicated into the kind of to the point of oblivion in order to manage their distressing symptoms. But now they have another option. They don't have to do that. And I sometimes hear people, especially physicians, who say, "Oh, we can mitigate any symptoms. We can palliate anybody. Why would anybody? There's no need for people to take that drastic action." Some people don't want to be palliated. Some people don't want to have other people medicating them to the point where they can't communicate. And there's a loss of dignity and a loss of autonomy and agency and personhood in that. And so the hubris, to me, the hubris of saying, "Oh, we can palliate anybody," I find that very challenging and not very considerate of the human experience.
Right. Quality of life is what the patient decides it is.
Exactly.
So let's switch gears a little bit because we're winding down. We get ready to close this. Bob, how do you find yourself changed by working with the dying?
Mm-hmm. So working in healthcare in general, as an emergency physician, being around people whose lives changed dramatically in an instant, I've felt that the sort of the random, that there's a certain randomness to life and what happens to us, and I have a much greater appreciation for the fragility of life, and working with people at end of life and being in the position of supporting them and their families in the way that my team and I do allows me to I have very, very little fear about the dying process because I know how beautifully it can happen when it's done properly. I think a lot of people are afraid of dying because they fear that dying is going to be painful and a struggle. And in many cases it is. I understand why they would have that fear.
Sure. But
I've seen it on time and time again where it can be done really beautifully with the right approach and the right attention and the right care and team. So I have a lot less fear around what happens in the final stage of life. I'm also grateful that I live in a state that allows medical aid in dying in case that becomes my chosen, option. And I feel incredibly privileged. I am every day feel honored and privileged to be able to be with people who entrust me to guide them and to be with them through this most intimate experience that most people ever have. And mostly I just feel grateful. I feel grateful that I found this work, or it found me, and the people that keep showing up to be part of it, to join our team, and to support our community. I can't imagine doing anything else at this point in my life.
Bob, how can my listeners connect with you and with your wife, Elizabeth, and work with Empowered Endings?
So we have a website, empoweredendings.com. We have there's a lot there. It's a pretty robust site that talks about the services that we provide, the medical group services and counseling. We have an institute with a lot of educational material, and there's a community, there's a membership that people can join our community. And the community is really comprised of healthcare workers who want to learn about end-of-life care, optimal end-of-life care, doulas, and also people in the community who are interested in learning about what's possible, what's available, what the options are, and how to support themselves or their loved ones through the journey. And for people who are interested in learning about our services directly, we basically have a free consultation with anybody who calls. One of our team members is willing to have a conversation and help people, understand a bit more about what they're dealing with and what the resources are out in the community, in the various communities, to offer support to them. And if it's somebody in the Southern California area that we can physically support, then we'll kind of educate them about that as well.
Well, thank you for your time today, for your wisdom, for sharing your personal story. I think it's so meaningful for those of us who work in healthcare, who will also at some point be caregivers. And of course, at some point, we'll also be patients as well. So thank you for the work that you're doing. We're so grateful.
Oh, you're welcome, Helen. Thank you for doing this. Thank you for having this podcast so that people can come on and share their wisdom and experience, and we're all in this together, right? We're all trying to make end of life care better for everybody. So thanks for partnering.
Be sure to catch the next episode of the Heart of Hospice podcast. You can find more episodes on theheartofhospice.com, and don't forget to follow us on your favorite podcast platform. You can connect with the Heart of Hospice on Facebook and Instagram, and send your questions or comments by email to helen@theheartofhospice.com. And remember, no matter who you are or where you are in your hospice journey, you are the heart of hospice.
This is the Whole Care Network. Helping you tell your story one podcast at a time.